Welcome. I want to start with a moment of validation. If you are a woman over 50, whether you are 5 years post-menopause or 20, and you feel like your climax button has subtly faded or maybe disappeared altogether, please know this. You are not broken. You are not alone. This frustration is incredibly common.
Welcome. I'm Dr. Emma. Too often, the health needs of women over 50 are ignored or misunderstood. Not here. I have dedicated 15 years to researching the unique biological changes of midlife. I'm here to cut through the noise and bring you the practical, science-backed insights you deserve. Welcome to your best years.
For many women, orgasm after 50 shifts. It often takes longer, requires more direct stimulation, and sometimes the sheer intensity needed to push you over the edge just feels elusive. You've likely heard of the stop-start technique in the context of male sexual health, usually for treating premature ejaculation. But today, we are completely flipping that script. We are adapting this technique for us, for women who need to dramatically increase sensation, build resilience, and maintain that exquisite state of high arousal long enough to meet that new threshold for climax. Today, we are going to learn how to use the stop-start method to essentially rewire your arousal response and reclaim pleasure.
Before we master the technique, we must understand the why. This isn't just about aging, it's about estrogen. The loss of estrogen impacts climax in 3 key ways: vaginal and vulvar atrophy, or GSM. Estrogen keeps the tissues of the vulva, clitoris, and vagina plump, moist, and well vascularized. When estrogen drops, these tissues thin, atrophy. This thinning often means less natural lubrication and, crucially, less protection for the sensitive nerve endings. Diminished blood flow. Orgasm is fundamentally a vascular event. It requires significant blood engorgement, or vasocongestion, around the clitoris and surrounding nerves. Estrogen helps regulate this flow. After menopause, reduced estrogen and age-related changes can mean it takes much longer to achieve the necessary vasocongestion to push you into climax. Sensitivity roulette. Some women experience clitoral hypersensitivity, where touch becomes painful or irritating before arousal is high enough. Others experience the opposite, hyposensitivity, where it simply takes a massive amount of sustained effort to register sufficient pleasure to trigger climax. The stop-start technique directly addresses the lack of sustained blood flow and the sensitivity issues by training your body to tolerate and harness that peak level of pleasure. In our younger years, arousal often felt like a light switch, on or off. Post-menopause, it's far more like a dimmer switch. The key to the stop-start technique is recognizing your personal pleasure edge. This isn't the point of no return. This is the plateau threshold. Think of it this way. As you stimulate yourself, pleasure builds until you reach a point where any more stimulation feels either too much painful or irritating if you have hypersensitivity, or you worry you're going to lose the sensation completely. That moment, that peak where the sensation is strongest but feels unstable, is your plateau threshold. Most women, when they reach this edge, push harder. They want the climax now, but if you push too hard, too fast after 50, you often bypass the threshold or simply overwhelm the nerve endings, leading to a sudden loss of feeling or irritation. The goal of the stop-start is to introduce the concept of tolerance training. We're going to teach your body to stay right on that beautiful, intense edge and strengthen the neural pathways associated with that feeling. The traditional stop-start technique involves 3 phases: stimulate, stop, and restart. We are going to use a 4-phase cycle, adapted for heightened sensitivity and slow build pleasure. Stimulate, the ascent, applying steady, consistent stimulation. Approach, the threshold, hitting your highest pleasurable intensity, that unstable edge. Halt, the hold, stopping all physical movement and stimulation. Wait, the reset, allowing the intensity to subside slightly, also refocusing and integrating the pleasure before resuming. This method forces blood to stay pooled in the clitoral region, maximizing vasocongestion, and teaches your nervous system that sustained, high-level pleasure is safe and achievable. Your practicing this alone removes performance pressure and allows you to truly identify your unique plateau threshold. Step 1. Preparation and environment. Time. Choose a time when you have at least 30 minutes of uninterrupted privacy. Anxiety is the biggest enemy of climax. Lubrication. This is non-negotiable. Use a high-quality, long-lasting silicone or water-based lubricant. Apply liberally to the entire vulva area and the clitoris. Tool. A vibrator is often essential post-menopause due to the need for high-frequency, sustained sensation. A clitoral vibrator with adjustable intensity is ideal. Step 2. The cycle initiation. A. Stimulate, the ascent. Begin stimulation or vibrator or manual slowly and indirectly. Spend at least 5 minutes just warming up the area and achieving basic arousal. This ensures initial blood flow. B. Approach, the threshold. Gradually increase the intensity or directness of the stimulation until you reach the plateau threshold. This is the point where the pleasure is exhilarating, but you think, I can't take much more, I need to stop, or I'm going to lose it. Do not go past this point. Step 3. The halt and wait. C. Halt, the hold. Immediately and completely stop all movement and stimulation. Lift the vibrator away from your body. D. Wait, the reset. Breathe deeply. Focus only on the exquisite residual feeling. Wait approximately 30 to 60 seconds, or until you feel the intensity drop by about 30%. Crucially, do not wait until the sensation disappears entirely. Step 4. Restart and repeat. Restart stimulation, aiming to quickly return to your plateau threshold. Repeat the stimulate, approach, halt, wait cycle 3 to 5 times. Each time you repeat the cycle, you are strengthening the vast congestion and widening your tolerance for intense pleasure. On the final cycle, once you hit the plateau threshold for the 3rd or 4th time, you will feel a new level of stability. Only then do you continue the sustained final push toward climax. Bringing a partner into this process requires communication, not mind reading. Your partner's role is to be your assistant and your timekeeper. Key communication rules. The dimmer switch analogy. Explain the concept of the plateau threshold to your partner. We are trying to keep the pleasure level at an 8 or a 9 out of 10 without hitting 10 yet. The verbal stop command. Establish a clear, non-negotiable verbal command for stopping. For instance, pause, or hold, or red. When you say the word, they must stop immediately and completely. Partner role. Hands or mouth. Have them practice the cycle using their hands or mouth first. This allows for precise, focused stimulation that you can control. Partner role in intercourse. If integrating this into intercourse, the partner must be willing to withdraw the penis or stop thrusting completely upon command, allowing the female partner to maintain the pelvic hold and reset. This is a practice of delayed gratification for both of you. The benefit of the partner assisting is that the brief break, the halt phase, can be used for deep eye contact, kissing, or verbally expressing the pleasure you are currently feeling, which actually amplifies the residual arousal. The stop-start technique works best when the underlying physical issues of atrophy and blood flow are addressed. Addressing dryness and atrophy. Moisturizers versus lubricants. Use a hyaluronic acid or polycarbophil-based vaginal moisturizer like Replin's or Reverie 2 to 3 times a week. These are not lubricants for sex. They actively hydrate and plump the vaginal tissue, making the entire area less fragile. I'm Dr. Emma. Localized estrogen vaginal therapy. The health needs of women over 50 are ignored or misunderstood. Localized vaginal estrogen therapy. I have dedicated creams, 15 years tablets, to researching the unique biological changes of midlife and is the most effective way through the noise to restore and bring you the practical and vascularity of the genital tissue, fundamentally increasing sensitivity. Strengthening blood flow. Kegel exercises or pelvic floor, regular Kegels or contracting the muscles that stop the flow of urine are vital. They strengthen the muscles that wrap around the vaginal and clitoral arteries. A strong pelvic floor means that during the stimulate phase in the stop-start cycle, you can voluntarily contract these muscles to help trap and pool blood in the clitoral region, enhancing the sensation buildup. Aim for 3 sets of 10 contractions every day. Mind-body connection. Use your wait phase in the stop-start cycle to visualize the blood flowing powerfully to your clitoris and vulva. This conscious focus enhances nerve response. The journey to postmenopausal pleasure is not about chasing the orgasm of your 20s. It's about accepting the new rules and mastering the new controls. The stop-start technique is a powerful tool for that mastery. It converts a physical constraint, reduced sensitivity and blood flow, into a conscious, repeatable practice that expands your capacity for intense pleasure. Remember, patience, communication, and lubrication are your best friends on this journey. Be gentle with yourself and celebrate the buildup of sensation as much as the final release.